Which of the following non-pharmacological interventions is most likely to provide symptomatic relief for this patient? 65-year-old woman presents a 3-year history of progressive hand tremors. She reports that the tremors are most noticeable when she tries to hold objects, cup or pen. Okay, so like fine tremors, and they improve when her hands are at rest. She denies any rigidity, bradykinesia, or postural instability. Her father had similar symptoms. Physical examination reveals bilateral postural and action tremor in the upper extremities and no other neurological defects. Okay, so bilateral postural action tremor. Which of the following non-pharmacological interventions is most likely to provide symptomatic relief? Okay, she has the.
So what's the diagnosis? I want you to.
I'm trying to think. Is this just a fine tremor, like an essential tremor?
Good.
Um,
Good. So that's your diagnosis, likely an essential tremor, right? Which gets worse
yes.
with actions, especially, under pressure, right?
Okay.
So what do you want to do?
Um, I'm not too sure. I mean, occupational therapy seems okay. I don't think it's like a physical therapy. It's not like musculoskeletal. Um, DBS, I know it's for like, treatment resistant depression. I don't think it's yoga. Biofeedback's interesting. I just don't know anything about biofeedback if that's a viable option for this. I mean, I don't know author about occupational therapy also doesn't. I don't know. It just
So
seems
what
that occupational therapy would be more readily available.
so
So
what's
I
your
would.
gut say? Let's talk about
My
that.
gut says occupational therapy, but I mean, biofeedback could be a great answer. I'm just not too sure.
Okay, so now do you want to keep it or change it here?
I think I'd have to keep it because I'm not definitely sure I picked the wrong one or forgot something.
Okay, so let's
Oh,
figure it
it's
out. I
DBS.
actually
Okay.
I actually don't know, didn't know what the
Okay.
treatment for essential tremors, but that's
Okay.
non-pharmacological, that is. Presents with
Okay.
progressive hand tremors. Okay, history of this, essential tremors. We got the diagnosis, so
Mm-hmm.
bingo, that's
Mm-hmm.
good. Deep brain stimulation is a surgical intervention that involves implanting electrodes in specific brain regions of this, affecting and reducing severity of tremors in patients with symptoms who have not responded to pharmacological treatment or have significant functional impairment. Let's see. Which of the following non-pharmacological is likely to provide symptomatic relief? Okay, let's talk about
Okay.
the rest. That seems really, really invasive. So let's see if that's correct here. Biofeedback, learning controls, physiologic sets, heart ranging through the motion. While it may be helpful in managing stress anxiety, does not has not proven.
Okay. Good. Okay. Good. I wasn't sure. Okay.
Okay. Occupational therapy help patients to learn strategy to adapt their terms and maintain independence in daily activity. However, does not directly address the underlying
Yeah.
neurological cause of tremors, unlikely to prove significant symptomatic relief.
Makes
Physical
sense.
therapy can help, but is not specific treatment for essential and is unlikely to provide significant relief for tremors. Yoga may help overall well-being with stress, but not proven treatment for
Okay.
essential tremors. Okay,
Okay.
but let me see which of the following is most likely to
DBS.
provide symptomatic. Oh, okay. So
Yeah,
the
it's
question is
symptomatic
kind of
relief.
interesting. It doesn't usually the question asks you what's the initial next step of
Yes.
management, right? Which I would say B is definitely not your answer, right?
Right.
Because you would try all these things before you do
Correct.
this deep brain simulation.
Yeah,
But the
that's what I was thinking. Like when I see them, it's like, oh yeah, treatment resistant depression, and then it's just like for years, and then you have to go do something like that. So,
exactly. Exactly. So I
okay.
mean, I would say that it's good to this is a good question. And no, I don't know if they'll ever test you since it's so low yield, but just remember the reason why I'm mentioning this is if they rephrase this question as non-pharmacological interventions, do you start with initially? That's going to be any one of these things. It can be occupational therapy, it could be physical therapy,
Okay.
it could be yoga. You get what I'm saying? This would
Yes.
never be like a first thing you do, right? You're not going to
Okay.
be like, hey, you have an essential tremor. Let's do this huge brain surgery to fix it, right?
Right.
So
Okay.
just so you know, right? So we're on the same page.
Okay.